Hello everyone, I am Dr. Swesha Khanijo, IVF expert, obstetrician, gynecologist, laparoscopic surgeon at Angels Hope IVF at Savanilu Angels Hospital, Saket, New Delhi. Today, let's dive into a very important topic which affects millions of women worldwide, that is Polycystic Ovarian Syndrome. Now, this is a disorder of reproductive age group, but the surprising part is many women don't even know that they are suffering from it. So let us just break it down into simple terms. So now let's talk about what is PCOS. PCOS is basically a hormonal imbalance. In this condition, we have an imbalance between the hormones where we have excess of male hormones, which causes formation of small cysts in the ovaries, which are fluid-filled. But don't worry, these cysts are just because of the hormonal up-down and not the other true cysts in the ovaries. How do you know that you have PCOS? Let's talk about certain common complaints with which you can present to a doctor. You may come with a history or complain of that you're having irregular cycles. Now this irregularity can be in form of that you're having frequent periods, you're having delayed cycles, or you're just not having periods for a very long time. You may present with acne. Fresh breakouts can occur at any age, even in the adulthood. Weight gain. There is a history of weight gain, and there is also a complaint that we are trying to shed weight but it is just not happening. The patient can also present with abnormal hair growth, which can present on the face, chest, or at the back. Now the question arises, what causes PCOS? Well, it is still unknown, but genetics play a very important role here. If you have a family history of diabetes, there is a tendency that you may have PCOS in life. You have a lot of insulin in your body, but it doesn't seem to work. Thus, it makes you prone to get diabetes later in life. Now, when you have more insulin in the body, there is more androgens which are produced by the ovaries, and that is what gives rise to all the symptoms we've spoken about. The good news is that PCOS can be managed. The management depends upon the symptoms with which you present. The first and the foremost thing is lifestyle management. You need to control your diet, have a good healthy lifestyle in terms of good physical activity and stress management. When I talk about diet, have a good high protein, high fiber diet. Coming on to physical activity, yoga, gym, walk, everything helps you. But there are times when you're doing everything and still you're not able to shed weight. That is the time when insulin resistance comes into play. We need to put you on certain kind of medications which can help you in losing weight along with your health. That is, you are controlling your lifestyle yourself. And as a doctor, I'm going to give you certain medications which will help you in losing weight. Now, when I say that treatment depends upon symptoms, well, if the patient is presenting to us with acne, we give the patient medications in terms of giving them oral medications and certain topical application. If a patient is presenting to us with irregular cycles, there are times when we need to put these patients on birth control pills. If the patient is presenting to us with infertility, we have to treat them with certain medications which can make their eggs, and then by serial ultrasound, we just follow up the patient and treat the patient accordingly. Now coming on to certain myths which are associated with PCOS. There is a myth that PCOS generally happens with patients who are overweight. Well, even lean women are prone to get PCOS, and trust me, that is more difficult to manage. Another myth is that PCOS can only cause infertility. Well, if you've heard this video, I have spoken about very many symptoms with which patient can present. So it is not only infertility which can happen in patients with PCOS, as it affects many other systems of the body. Then there's another myth that if you have PCOS, you cannot get pregnant. But well, with proper treatment and proper lifestyle management, pregnancy is definitely a possibility and it can happen. It is well said that PCOS is caused by poor diet and poor lifestyle. In a way, it is true, but it is not always because of that. There is a genetic component attached to it. So as I said before, that if there is a family history of diabetes, you are more prone to get PCOS. There is a myth that PCOS is not a very serious condition. Well, I would not say that it is a very serious condition, but if it is not managed well on time and properly, it can cause various other problems which can happen later in life. like diabetes and certain cardiovascular disorders. Now, if you think that you are having this problem of PCOS, do not forget to schedule an appointment with us. Together, we can run certain diagnostic tests and have a tailored approach for the management of PCOS depending with what symptoms you present to us. Your health is our priority. So let us take these steps together and fight PCOS. And of course, if you find this video helpful, like, share and subscribe and stay updated with more such videos.